Hi everybody, welcome to VigiServe Foundation. My name is Manoj Swaminathan and today I am going to talk about a very important concept in pharmacovigilance which is Dechallenge and Rechallenge. First, let us try to learn what do you mean by challenge. Challenge means giving of the drug to the patient during the adverse event or treatment in question. Here, there are two concepts. The first concept is de-challenge and the other is re-challenge. Now, we will learn about both these concepts in detail. First, let us learn about de-challenge. Now, in this slide, you can see four images. The image on the right talks about a patient who has got a lot of medicines in hand. On the left, you can see stoppage of the medicine. On the right, you can see reduction in dosage of the medicine. And in between, you can see adverse event. Right? So now we will learn about positive de-challenge. Now, let us assume a patient has been prescribed a medicine for acne. The patient took the medicine and developed discoloration of the teeth. The patient went back to the doctor and told that this is what has happened. So the doctor suggested to stop the medicine. Now, what happens? The patient realizes that the adverse event has disappeared. So, this is called positive de-challenge. Here, the patient took the medicine, had an adverse event, patient stopped the medicine, and the adverse event disappeared. So, this is called positive de-challenge. Now, we will go to the next important concept, which is negative de-challenge. Now, imagine a patient who was prescribed a painkiller for his joint pain. After taking the medicine, the patient developed rash on his forearm and elbow. Now, the patient went to the doctor and said that this is what has happened. So, the doctor suggests to stop the medicine. After stopping the medicine, the patient realized that the rash has not disappeared and it remains to be there. Now, this is called negative de-challenge. The patient took the medicine, had an adverse event, patient stops the medicine, but the adverse event continues, and that too with the same intensity. So, this is called negative de-challenge. Please remember that even dose reduction constitutes de-challenge. Imagine a patient has taken the full medicine and has developed an adverse event. Now, if the dose is reduced and if the adverse event disappears or reduces in intensity, then even that is considered as positive de-challenge. Now, here is where we bring in another important concept, which is partial de-challenge. Here, there is minor reduction in the intensity of the adverse event. If the patient reduces the dose and the adverse event reduces in intensity to even the slightest of the extent, then it is considered partial de-challenge. Please remember, in case of withdrawal reaction, positive de-challenge is when the medicine is again given. Now let us look at this concept with an example. So this patient has depression and he's on an antidepressant. The doctor suggests that the patient is now doing well and doesn't require the medicine any long and suggests to stop the medicine. Now what happens? The patient develops tremor. So the doctor suggests to again start the medicine and the tremor disappears and the patient is back to normal. So here we have a classical withdrawal reaction where reintroduction of the medicine has resulted in the adverse event waning off. Now, let us look at the next important concept, which is re-challenge. Re-challenge necessarily means restarting the medicine and the reinitiation of the adverse event. Now, let us learn about this concept in detail. First, let us learn about positive re-challenge. Again, consider an hypothetical scenario where the patient was given a medicine for her acne. The patient developed discoloration of the teeth. So the doctor suggested to stop the medicine and the discoloration disappeared. The teeth are back to normal. But the underlying infection still remains. So the doctor suggests to start the medicine again. And now what has happened? The patient has again developed discoloration of the teeth. So this is called positive re-challenge, where reintroduction of the medicine has resulted in reinitiation of the adverse event. So this is called positive re-challenge. Now, on the similar lines, let us learn about negative re-challenge. Again, the same hypothetical scenario. The patient was given a medicine for her acne. She developed discoloration of the teeth. The doctor suggests to stop the medicine. The discoloration disappeared. The teeth are back to normal. Now, the acne has increased in intensity. So, the doctor has again started the medicine. And now, what has happened? The adverse event has not recurred, right? So this is called negative re-challenge. So here what has happened is reinitiation of the medicine doesn't result in recurrence of the adverse event. So this is called negative re-challenge. Okay. Please remember, even reduced dose and the reintroduction of the same also constitutes to re-challenge. For example, if the patient was on 500 milligram tablet, had an adverse event, and then the patient again started taking 250 milligram tablet and again has an adverse event, then it is considered as positive re-challenge. Similar lines, we also have partial re-challenge concept in pharmacovigilance, where there is minor recurrence in the intensity of the adverse event. Apart from all these, you also have some parameters in the safety database which are unknown and not applicable. So you have positive de-challenge, negative de-challenge, then you have positive re-challenge, negative re-challenge, and you also have concepts like unknown and not applicable. So when are these used? Look at this scenario where you don't know what has happened to the suspect drug. The patient took the medicine, had an adverse event, and after that you don't know whether the patient has stopped the medicine because you are not able to trace the patient, you are not able to undertake follow-up with the patient, and as a result you don't know about the re-challenge status. As a result, it is considered to be unknown. On a similar lines, if the patient takes the medicine and dies, so in that case, de-challenge and re-challenge will be not applicable, right? Because you don't have information, right? Now, let us do one exercise. Learning with an example will always help you. On 1st June 2021, Rani was started on amoxicillin 500 mg thrice a day for her throat infection. On the next day, that is 2nd June 2021, she developed rashes over her body. On 3rd June 2021, the dose was reduced to 250 milligram thrice a day. On 4th June, the rash disappeared. So here what has happened? The patient took the medicine, had rash all over the body, the dose was reduced, and the rash disappeared. So what is this? This is positive Dechallenge. Although partial, because the dose was reduced, it is still positive Dechallenge. Now imagine if the patient was again given the medicine. As the intensity of infection increased, the dose was again increased to 500 milligram thrice a day. I'm talking about amoxicillin. And this happened on 5th of June 2021. And again on 6th of June, she developed generalized rashes. So here what is it? Reintroduction of the medicine at a higher dose, and again adverse event recurs. So this is called positive rechallenge. Okay. Now you might be wondering why we are learning about this concept. Now if I ask you a question that if there is positive Dechallenge, do you think that the adverse event might have caused due to the drug? The answer is yes, right? Again, if there is positive rechallenge, is it related to the medicine? More likely, right? So the main application is in causality assessment to determine whether there is a causal relationship between the medicine and the adverse event. So that is why it is very important to learn about Dechallenge and Rechallenge. I trust you found this session to be very interesting and very useful. Feel free to reach out to us if you have any questions, comments, or suggestions. Thank you.